let's get right into it. Today we're talking about Pheniramine. Now, this is a really powerful, super fast-acting drug that's basically a hero on the front lines of emergency medicine, especially, when you're talking about those sudden, really severe allergic reactions.
It can happen in a split second. A bee sting, a weird reaction to a new medicine, and bam! Suddenly, you're looking at some seriously scary rapid swelling. This is exactly the kind of thing that rushes people to the emergency room, and in those moments, believe me, every single second is crucial.
So, when your body's defense system just completely goes into overdrive, what do the pros in the ER actually reach for? What's the go-to tool to shut that reaction down and shut it down fast?
Well, in a whole lot of cases, the answer is this right here. Pheniramine. It is a major player in that emergency toolkit, and it's built for one reason, to stop these kinds of reactions dead in their tracks.
So what exactly is this stuff? Well, technically, Pheniramine is what's called a first-generation H1 antihistamine. Now, that first-generation part is really important because it tells us two huge things. One, it's incredibly fast and super powerful. And two, it can get past the blood-brain barrier. And that is the key to its biggest side effect, which we're definitely going to talk about in a minute.
You might not hear Pheniramine maleate thrown around, but you'll definitely see it under brand names, one of the big ones being Avil. This stuff is a total staple in hospitals and emergency kits all over the world, just waiting to be used when things get serious. Okay, but how does it actually pull off this rescue mission? Let's get into the science a little bit and see how Pheniramine literally slams the brakes on an allergic reaction.
So the main bad guy in this whole story is a chemical that your own body releases, and it's called histamine. When your body freaks out and thinks it's being attacked by an allergen, it just floods your system with the stuff. And that is what causes all those classic symptoms we hate. The itching, the swelling, the redness, all of it. This is where it gets cool. Think about it like a lock and a key. Histamine is the key, and it's desperately trying to jam itself into these little locks on your cells. We call them H1 receptors. Once it gets in, boom, the allergic reaction is unlocked and starts running wild. What Pheniramine does is it basically swoops in, gets to the lock first, and blocks the keyhole. Simple as that. If histamine can't get in, it can't start the reaction. Problem solved.
But wait, there's more. Its job isn't just about allergies. Remember how we said it's first generation and can get into the brain? Well, that gives it some other really powerful effects. The big one? It's a serious sedative. That's why it makes you so drowsy. On top of that, it can also help with nausea and vomiting. And this is a huge plus for allergic reactions. It is fantastic at stopping that absolutely maddening itch.
All right, so we know what it is, we know how it works, so let's talk about the real world. When do doctors actually look at a situation and say, yep, this is the right tool for the job?
Well, because of that trade-off, you get incredible power, but also some major side effects. Pheniramine is really saved for the serious stuff. We're talking about really bad hives, what doctors call urticaria, or that rapid swelling known as angioedema. It's for those nasty reactions to insect bites or other drugs. It's also used as a backup or an adjunct therapy during anaphylaxis. That's the absolute worst-case scenario for an allergic reaction. It works alongside the #1 treatment, adrenaline.
And check out this number, because it really shows you how potent this is. The standard concentration is 22.75 milligrams in a single milliliter. A milliliter. That is a tiny, tiny amount of liquid, but it packs a massive punch. This is no over-the-counter pill you just pop. We're talking about a high-strength medicine designed for real medical emergencies.
So, how do they give it to you? Usually in one of two ways. Either an injection straight into a big muscle like your arm or thigh, or it goes directly into a vein. Now, the IV route has a big rule. It has to be done slowly. You can't just slam it in. Pushing it too fast can make your blood pressure drop, and that's a whole other problem you don't want.
Now, of course, with any tool this powerful, you've got to talk about the risks. So let's get into the fine print. These are the side effects and the safety warnings that you absolutely have to know.
Okay, the #1 biggest side effect you need to know about is the drowsiness. And I'm not talking about feeling a little tired. This is some serious sedation. It's exactly why anyone who gets this drug gets a strict warning. Do not drive. Don't operate heavy machinery. Don't do anything that requires you to be sharp and alert. And it's really important to understand the difference between caution and contraindication. Doctors will use it with caution for folks with conditions like asthma or heart disease. But for some people, it's a hard no, a total contraindication. We're talking about patients with things like narrow-angle glaucoma or an enlarged prostate. For them, the drug's side effects could make their existing conditions way, way worse.
And this is a huge warning. You cannot mix phentermine with anything else that slows down your central nervous system. I'm talking especially about alcohol. The combination is just incredibly dangerous. It can crank up that sedative effect to a potentially life-threatening level. Bottom line, they should never, ever be mixed, period.
Okay, so let's zoom out and look at the big picture here. What's the final verdict on phenteramine's role in medicine today? So, in a nutshell, here are the key takeaways. First, phentermine is a super fast, super effective tool for allergy emergencies. Second, it works by blocking histamine. Third, its biggest side effect is that powerful drowsiness. And finally, because it's so strong and has real risks, it absolutely has to be used under medical supervision.
And all this leaves us with a pretty interesting question, doesn't it? I mean, we live in an age where there are all these newer antihistamines designed specifically so they don't make you drowsy. So, what's the future for this powerful, kind of old-school emergency fighter? Its speed and its raw power are still second to none in a crisis. But will that major sedative effect eventually mean it gets pushed aside for something new? Something to think about.